during this really tumultuous time. I think we all share the anxiety of the pandemic and some civil unrest going on in our world, but it's nice to be able to take the time and distract ourselves with another issue that is really important to all of us, and that's ending Parkinson's disease. And our focus will be on the PD Avengers today, what we've been up to, our numbers and so forth, updates from our committees, and also an opportunity for us to hear from you and what your needs are in the community and how we can collaborate to help things move things forward. And I'll throw it to Larry to update us on some numbers.
Thank you. Tim, if you could give me the control back. I will share my screen.
Oh, yes.
Thank you. Let's see here. And I'm going to go here, and I'm going to go up here. And share my screen. I hope you can all see that. Here comes Lorna. Everybody say hi to Lorna.
Hi.
Hi,
Hello.
Hey, Lorna.
Hi, Emma.
All right. So what you see here is today's agenda, and we've got a few things to get to, and then we want to talk to you too, and really get to understand what you'd like to do as far as it pertains to the PD Avengers, because everybody kind of has a different way they can get involved. And the fact that you're here is exciting for us, and we're really excited to announce today that we now are in 50 countries and territories around the world as of last night, which is amazing. This is a map of all the red is places where there are PD Avengers. So we still have a few countries to pencil in there, but that looks pretty awesome. So thanks for all your hard work of spreading the word and getting people to sign up. I know we have some all-stars here. Carlotta Lee, I think she sent out 1,000 emails. Is that right, Carlotta? Well, she's not listening to me. Because I made her wait.
Sorry, I am.
Was it 1,000 emails you sent out?
Yeah, about 1,300.
Oh, whoo-hoo!
Yeah.
All-star. Thank you very much.
Well, Larry, that's what I want to know, which of the 1,300 signed up, because I'm going to go knock on their door again.
Yeah, I'm not sure which, but yeah, we can talk offline.
Yeah.
So we just picked up Uruguay, which was our 50th country or territory in South America, which is great. I'm learning all about the globe now because I'm all these great people. Is there anybody from Romania on the call? We are getting a lot of people from Romania signing up, and a lot of people from Germany. I know we have at least one person from Germany on the line. If you'd like to introduce yourself, we'd like to say hello.
Hello. If I I can say hello. I'm very happy to share this meeting with you, and it's just 2 weeks ago. First time I realized of the existence of this movement from the PD Avengers, and it's a really great thing. I'm very excited, and I appreciate to work with you, and hope we have a big resonance in Germany.
Well, there's a lot of people signing up, and from Germany. Quite a handful from Stuttgart.
Fine.
And where are you at?
I'm from Stuttgart, Germany. It's
southwest of Stuttgart.
Germany. Some of you maybe Americans know about Heidelberg. It's about 100 keys south from Heidelberg.
Okay, great. Well, welcome. We love having you here. Thank you for being here and being a PD Avenger. You've just found out about it 2 months ago. We just started this about 6 months ago. So we are growing leaps and bounds, which is nice. We now have 2,033 PD Avengers. Oh, we hit the 2,000 mark yesterday. So that was great. So thank you. And we have 33 different partners. So here's a little word cloud that I put together of all the people that have signed up so far. and most of them are in the United States, Canada, and the United Kingdom, but we've got them from all over the place, which is just really exciting for all of us. I'll leave that up there for a few minutes if you want to see what you've got, see if you forgot, if you can see where you're from. And then I just want to say, is there anybody else that would like to say hello from from where you are? Or this is a good time to just sort of hop on and get to know each other a little better. Anybody else want to say hi?
Hey, Larry. I'm Lauren. I'm from Southern California,
Hi,
down
Lauren.
in Orange County. I met you in Anaheim at the Fox event over a year
Yeah.
ago, and we're just trying to spread the word here.
Well, thank you. We really
Good to
appreciate
see you
that.
guys.
It's good to see you too. Thanks for being here.
I'll say hello. My name is Richard Huckabee. I live outside of Cleveland. I've had Parkinson's since 2013. I was diagnosed, but I had it 9 years before that. And in Cleveland, we have a place called In Motion that is teaching us to be super Avengers. I love this concept, PD Avengers. I'm a big comic book fan, so love this.
Oh, that's great. That's great. Yeah, I'm very familiar with the people that started that. We're both on the Fox Patient Council together. And
Yes, Karen Jaffe.
yeah, Karen is amazing. And I grew up in Ohio, so hey, Ohio roots. Anybody else want to say hello?
I'm Paul Mayhew Archer. I'm from Oxford in England. A lot here with Sally, who's also from Oxford in England. And we've got the honor of having Baz Blum and Ray Dorsey coming to talk to our group on the 3rd of February. And we've opened it up. Parkinson's UK runs 350 local groups around the country in the UK. So we've invited people from all the groups, and we were amazed that 400 people signed up in about 3 days.
Mm.
So
Wow.
we're practically full now.
That's
so we're very
amazing.
excited. There's a lot of
Congratulations.
interest out there.
Yes, for sure. For sure.
And we're hoping then that the modern communications will enable us to meet with our other local groups more often, because we think that together we can make more of an impact.
Well, yeah, I believe that to be true. Oh, sorry about that. I didn't mean to come out there. Let me just stop sharing because I have to admit somebody in. There you go. Okay. And hello. Okay. Anybody else want to say hello before we move on?
I'll say hi from Toronto, Canada.
Oh, Toronto.
Just wanted to let you know that I find your podcast very inspiring and the book Ending Parkinson's Disease very inspiring. My mother had Parkinson's and so did my grandfather. And I feel that we are a very quiet bunch of people and we need to be really loud and demand more.
Yes, this is our time. This is, I think 2021 is going to be the year of the advocate. That's what I feel. Go ahead.
Yeah, I really like that idea, Larry. Making it 2021, the year of the advocate. This is Bernadette Murray. I'm from Woodland, California, which is about 20 miles north of Sacramento in California. And I wanted to say a couple of the really exciting things in California that have happened in the past couple of years is that we have a Parkinson's disease registry that is collecting data through the California Department of Public Health, and also on the ballot that in this November election, there was more money that was voted and approved to go towards stem cell research. And it's exciting to see that there is an FDA approved phase 1 trial that's moving forward on stem cell research.
Yeah, that's happening in New York, I believe.
Yes.
Bernadette, I didn't hear that had passed. I actually vote in California, even though I live in BC, and I voted for that. So yay! All right. At least I feel like I got something out of that election.
Yes,
That's
indeed.
All right. Anybody else? All right, we'll continue on. I'm going to hand it over to Tim Haag, who is one of the founding members. He leads up our communications, and he is also very passionate about our initial 1 million Voices goal. Tim, take it away.
Thank you, Larry. Good morning, afternoon, evening, everyone. Glad to see so many people from around the world. It's very exciting to think that we're only 6 months into this thing, and that there can be so many of us from so many different places around the world excited about ending Parkinson's. My name's Tim Haig, one of the co-founders. And yes, I am very excited about a number of things that we're doing. I'm helping to spearhead or lead the communications team with PD Avengers that looks after the website and most all things communication. And one of the things I'm most excited about today is Sabella. Sabella, you've had a chance to meet. She is taking on our translations team. She has been with the UN, 14 years, Sabella, as a translator, and has joined us to help us translate things into French and Spanish to start, and to see where we go from there. So did I get that right, Sabella? All right, very good. Well, I'm
You just nodded.
Yeah.
I can translate that. She meant yes.
What did you say, Brian?
I said I can translate that. She meant yes.
Oh, good. Brian's also a translator. He reads head nod.
That's fantastic. So
It is very exciting, I have to admit. So that we go really global. That's a goal.
Absolutely. Absolutely. We see lots of numbers still in Canada, the United States, and the UK. And we're very excited to see those numbers grow outside of the West, if you will. I'm very excited to see South America coming on board, more countries in Africa coming on board, Romania, some places that we don't normally think about, but we're very excited to see that we're able to reach out and help people in parts of the world that don't always necessarily come in first of mind. And so we're very excited to have Sabella and others joining us to help us do that kind of work. Additionally to that, we're continuing to work on our website. We're working on a variety of things like a media kit and things in the background that you may or may not be terribly excited about, but things that will hopefully help us to get the word out about PD Avengers more quickly, more thoroughly, more succinctly, so that we can reach our goal of 1 million people by the end of 2020. The goal of 1 million people.
2022.
2022, what did I say?
2020.
Yeah, we passed it.
Yeah, we failed that one.
We failed that.
We got to 2,000.
A lot of folks have said, isn't that an extremely aggressive goal? And we're like, straight up, absolutely is. We have been hanging around with Parkinson's, having been described now for 200 years, folks. We don't have time to fiddle. Rome has been burning for a long time. We need to put this fire out and end Parkinson's tomorrow. So that we want to see 1 million PD Avengers by the end of 2022. And yes, it's going to take tons of work. It's going to take all of us doing lots of things to spread the word, but we can get there. I have absolutely no doubt in my mind whatsoever that we can get there, because in getting there, it means that we are going to help people live better with this disease. We're going to be able to provide the wellness therapies, that basic information, the basic medication, the basic therapies that people need around the world. We're going to be able to advocate better on behalf of ourselves. We're going to be able to advocate better on behalf of seeing more dollars come in for research, seeing a higher quantity of research being done and a better quality of research being done. And we know that doing all of those things will lead to the thing that we're looking for above all things, the end of this disease. And the way that we're going to get there is by having all of us around the world standing together with one voice, demanding that this disease is seen and treated differently than it has been for the last 200 years. So there's my stump. Let's go, folks. We got to go.
Yeah, we need to move. Our job is to add the urgency to this cause. They've got great smart scientists. They've got great neurologists and people creating technologies, and they're in the lab and they're working at the cellular level. That's great, but we got to speed it up. We gotta light a fire. We need an international fast action committee like they did for COVID, and we need to tackle this thing. And I think there's an appetite for that. I really do. And I think we've seen the red tape that we thought existed just sort of disappear when there was an urgent issue. And the global scientific community and research communities and all the governments came together because we needed to find a cure for this COVID-19. And I think that if we take that same model, we can begin to tackle one disease at a time over the course of the next decade. And I'd say by 2030, at this rate, we could probably cure cancer and PD and ALS and. But we got to get them all working faster and harder and smarter, sharing their data. The problem is they're repeating their scientific experiments because they're not sharing their information. So I feel a collaboration is one of those things that this decade is about, is bringing the community together, from the patients to the care partners, to the neurologists, to the researchers, to all the organizations. We all have to come together and walk the same direction and speak the same language and move. And really, we cannot go longer without our voice being heard. And
Right,
so
because the importance is that we will save money in the long run. Money spent now on finding a cure, because we are very expensive, because we live for a long time with great difficulty and great needs. So anything that can improve the medication and bring a cure will save the world a fortune in the future.
And the way that we get there, it has to touch everything that we do, everything that we think, everything that we breathe, every time we open our mouths about this conversation. It has to be in getting to 1 million people. We have to be a strong enough organization with a loud enough voice to actually be heard, because we know that for years and years we have not been heard. And the only way we will be heard is when we are big enough, loud enough, strong enough to demand to be heard.
Just to confirm, on the website, it says 50 million somewhere.
that's the ultimate goal.
The ultimate goal. So for us, it's just 1 million at the end of 2022.
Yep. Because let's start with 1 million and then we'll work our way up.
Yeah. That's doable.
I think you're right, Carlotta.
Yeah, it's doable. Because I noticed all those other places in the countries that I haven't been touched, I know people there, so I'll be sending emails.
Oh, good. Yeah.
Yeah. Yeah.
Excellent.
So what on your list, do you keep all the list of PD Avengers and where they're from? Just out of curiosity.
I know who they are and where they're from, yes.
Okay, good.
All right. Any other questions? Does anybody want to share how they've been reaching out and maybe some success stories that you've had in recruiting people to become PD Avengers?
Well, my story is a lot of my friends didn't know that I had it. So when I reached out to them and said, I got due to my diagnosis, this is what I'm going to do. So they all were shocked, and so they all signed up. So that was the first step.
That's great.
But I'm pretty good. I'm gonna send emails to all those people that didn't sign up and just knock on their head again.
Yeah.
They'll sign up.
Larry, I'm finding that you need to be persistent. We have 47 in our boxing group. We have about 30 in our local small chapter. And it's like there's levels to access those people. They've got it. Their trust has to be won through. Okay, well, I trust Lorna. I'll check it out. I will ask Parkinson's Canada if I can promote the PD Avengers to my local group. That's how the next levels go. So just keep knocking on the door of the gatekeepers who have more names for us. Like my local chapter, I want them to be supporting PD Avengers. And they've got to get that cleared by our Canadian national chapter. Just keep asking them to do it. That's what I'm finding.
And if anybody needs a letter or anything, Sonia, Tim, and I can help you out there. I know, like we're dealing with a group in Romania, and they got it approved through the lawyer to join. And so I think right now we've got 20 or 30 people from Romania that have signed up. And I've been invited to go stay there at their house next time I'm in Romania, which is amazing. I find Google Translate has been very handy as I'm communicating with the different languages around the world. Hopefully it's not putting in words that I don't want to say. I wouldn't know. So that's great. So any other tips?
Can I say something?
Sure, Sally.
Yes, I'm Sally from Oxford in the UK. And we have invited Ray Dorsey and Baz Bloom to come to talk to our group on February the 3rd, which is very, very nice. But then we thought, if they're going to talk to us like that, we ought to extend it. So now, with Paul, who spoke to you just a few moments ago, Paul has contacted or got the addresses of all the different support groups around the UK. And so far we have 400 people who have logged in to come. It's free. We're funding it, so it's free for everybody. And we got people signing up, like Billio is so exciting.
Because you're right, the charity didn't want to give us the list of addresses, of email addresses of the people, the contacts, even though they're on their website. So we just went through the website and got the addresses.
Is Lorna here? Or Lauren?
Yeah, that's me, Larry.
Hey,
What's up?
Lauren. So I got a note from somebody.
Larry,
Yeah.
may I interrupt? If you got
sure.
that note from me,
Yeah,
I'd like to say something.
please do.
I can't tell you how to recruit anybody, but I can tell you how I was recruited this morning,
Oh,
about an hour ago.
well, it's good to see you.
My friend Lauren over here, we've attended different groups together here in Orange County. And every meeting she stands up and talks about your group, the PD Avengers.
Oh, that's amazing.
Every time. And so today was the day that I joined up.
Well, and so welcome. We're happy to have you, and hopefully you'll be sharing the message as well.
Persistence. That's how you do it. Persistence.
Good. So now, Lauren, who is from pdbuzz.com.
Yep.
pdbuzz.com, and there's a link on our website if you go to our partners. She's doing a terrific job. Talk about what maybe some of the tactics you use.
Well, we have a newsletter that goes out every month, so I send out something pretty much every newsletter. I hit our Facebook page and our Instagram, and I'm tagging PD Avengers and everything. And another thing is, right now is a great opportunity to visit other support groups, because they're the ones that are happening right now are virtual, so you don't have to travel, you don't have to go anywhere. You can hit support groups all over your area and just ask if you can make an announcement about PD Avengers.
That's great. Thank you for doing that.
Larry, have you been able to get a hold of, basically be put on the World Parkinson's Congress email list?
Well, so we need to become an official nonprofit before we can join the coalition, which we're in the process of doing. And so we are working tightly with Eli Pollard and the World Parkinson Congress, and we will have a big presence not only at the World Parkinson Congress in Barcelona in 2022, but they've just announced the first ever World Parkinson Congress virtual, which will be this May online. And it's going to be very cool. And some of the PD Avengers will be speaking at that as well. So very excited to work with the WPC. And it's obviously the premier event for Parkinson's, where from patients to partners to scientists and researchers and neurologists and everybody come together in the same room, and it's really quite an amazing time. And then usually we're in a nice locale, so there's neat food and things to do and great people to meet. Any other questions or keys on recruiting? Okay, I'm going to move on to some other committees. We have a wellness committee, an advocacy committee, a research committee, and so I want to talk about what's happening in each of those groups. I know Amatola is here, and I don't know if you want to speak to what your group is up to, or if Kat Hill is here and she'd like to speak. I saw Amatola earlier. Did she drop off? Oh, no. Rochelle? All right. So I know that they are working on launching a campaign on our website where you print off a sign and talk about why you're a PD Avenger and why you want PD to end. And it's going to be black and white. It's going to be treated really cool. We're going to call it the wall. So we're working on that as one thing. We also have been working with Amatola and her new organization, Parkinson's Africa, and working on getting food, medicine, levodopa, to regions of Africa that traditionally can't access it. And so that's been something that has been really cool from day one of the PD Avengers. Sonia, Tim, anything else to add in regards to the Wellness Committee? You're muted.
No, nothing else from me.
Okay.
Actually, the other thing that it's not only medication, but Amatola and Rochelle are working on making sure they get information so that if there is a region where there is limited access to meds, at least the right information about how to live as well as you possibly can when you're in a really challenged situation with no meds, including exercise tips and diet and all of those sorts of things. They will be trying to make that as tailored as possible to the regions where they need it to be. And there's a huge piece of work going on there, but it's they're talking about using animations and various things like that just to make it as accessible as possible.
If you go to the Parkinson Africa YouTube channel, you'll see I think they have one of their animations up already, and it's translated into 5 or 6 different languages. So you can get a sample of what they're doing there.
It's noon, you hadn't eaten. Do you want another sandwich? Sure.
Yeah, I'll take a sandwich.
Caught me.
Okay, Tom. Eat up.
Caught us both.
I apologize.
No worries. All right, so advocacy committee, Matt Eagles, I know is here. Hello, Matt.
Hello, Larry.
There he is, Mr. Happy.
That's me, yeah. Go on, sorry. Happy New Year to everybody, by the way. And Helen prompted me to say this. So, and it's very kind and Happy New Year to you too. Advocacy's going okay. One project that I briefly, I'm very disconnected at the moment because I'm in a different environment.
Brian can interpret what you're saying. He knows how to read nodding heads.
It's the Wrigley. I think I might change my surname to Matthew Wrigley. No, what we're currently working on, I think I touched on it briefly, Larry, in an email to you, is Medtronic. I'm trying to develop a relationship with Medtronic. They have a foundation, and it used to be called the Backen Award, where they kind of back. Actually, it's named after Earl Backen, who founded Medtronic, and he used to award certain people who did for their own advocacy works in for. Let me just get this right. Yeah, he's basically for people who were great advocates for the challenges that they have in Parkinson's, in diabetes as well. So I'm a bit out of breath here as well.
You're doing great,
Cut
Matt.
a long story short, they're looking to take on the PD Avengers is one of their causes for the year. Now they have 90,000 employees globally. And I'm thinking if they want to sign up and help us, and it'll involve us doing an introductory talk to them at it's an annual event over 2 days later on in March, I think it is.
Yeah.
And we should get part of the sort of plan is to get as many of them signed up to become PD Avengers, the 90,000 employees, which will massively boost our membership and also our ability to, because obviously Medtronic are global, it'll enable us to work more, to get more global pull as well. So sorry if I haven't explained that very well.
No, that's terrific. And it actually, Matt, is a perfect example of how we're going to grow exponentially. So if you are connected to a business or an organization that has, you know, hundreds of people or thousands of people connected to it, or has a foundation that you can access, if just getting the word out to 90,000 employees, I know Gary Shaughnessy's working on that. We're working on trying to get a hold of these corporate, the corporate arms that are more charity focused, and letting them promote us to their group, and we can speak to their group or whatever. We could do presentations about Parkinson's and educate people, and then get them to sign up to really help become, you know, advocates, because their networks are, you know, also then reach out around the world. So that's the exciting part. That's how this grows exponentially. Once we've got 2,000 now, and if every one of those 2,000 people recruits 5, suddenly we have 10,000.
I think the crucial thing is as well is to try and persuade people this isn't just just an issue for people with Parkinson's and the wider community. This is a global issue, so everybody and anybody can be asked to join. And I think we need to stress this to make it clear.
Yeah, well, and Matt, somebody brought something to my attention the other day, and I hadn't thought of it that way. We've all heard that, you know, this is the fastest growing neurological condition in the world, and that by 2040, the number of people with Parkinson's will double. Yeah. Well, if you do the math, that's 19 years away from now. So if there's 10 million people in the world with Parkinson's, and it's going to be 20 in 19 years, most of those people are alive today.
Exactly, yeah. And it's going to impact them as well. And I think, I mean, the fact that this is going to impact so many people globally, I think we can I'm nearly sort of nosediving into my own phone now. We have
it on tape, so we can send it into Funniest Home Videos, and we may make some money that way.
Oh, I don't know why. I'm just very, very wriggly tonight. I don't know why. But
You're probably excited to see me.
Yeah, I'm excited. Not just you, Larry. I'm excited to see everybody. And can I say a big hello to Jim and his dad, who are on the call for the first time?
Yes, Jim and his dad.
So hi, Jim. Thanks for joining. And sorry I'm late, mate. But Jim is a wonderful chap and a very, very useful ally.
Hello. How's it going, Matt?
Yeah, very well, thanks, Jim. Very well.
I met Matt on the train.
Yes, you did. Yeah,
yeah. So
that's great. Thanks for being here. Tim and Sonia, or anybody, anything else to add to the advocacy committee?
I think I would just like to say, Larry, with the amount of people that are being diagnosed in earlier years now as well, people living with Parkinson's are living for a very long time with this disease. I think Paul Mayhew Archer mentioned earlier on about how expensive it is to support somebody with Parkinson's through their lifetime. And I think, you know, it's time now for us to get stronger and to be together and to be this global group that actually can make a big difference by shouting out. You know, it's time our voices were heard, and we've got this movement. It's absolutely incredible to see 50 countries on board within this last few months. And I think together we've got to act. And, you know, the message for me is that urgency is just it's breathing through my veins at the moment. And that comes as a result of being part of PD Avengers and being driven to actually speak up and do something. And I think that's the importance of this group.
That's great. Thank you.
Was that Jane, by the way? Sorry, Larry.
Yes, that was Jane.
Yes, it's me.
So many happy returns to Jane.
Oh, today's Jane's birthday. Happy birthday, Jane.
And I'm drinking alcohol. I'm really sorry, everyone.
Oh, no, don't be sorry. I think we all have to go there at sometimes when it comes to Parkinson's and birthdays. All right, research committee. Sonia, do you want to take the lead here and then pass it around if you'd like?
Sure. So the research committee, I mean, basically we are working on the premise that no decision about us without us. And that means having a patient voice at every step of the research process, from the inception or the direction of which research should go to, that should better serve our community, to developing the clinical trial protocols, to recruitment and retention, to then the dissemination of information afterwards. So we feel that patient voice is valuable and needed, and not just a token thing, but actually an engaged voice is needed at the table. So right now, what we're working on are some publication pieces. We're trying to write a couple of blogs and hopefully a research paper that will describe why we deserve a seat at the table, what is the benefit for researchers as well as industry to have us involved. And there are many that I could speak about at some point. But that's the main focus now. And then once we sort of accumulate information that we need, we'll be looking to actually approach.
So if you guys can mute your, if you're not speaking, please mute. Thank you.
Well, I did that thing, didn't I? In that meal in the oven.
If we could work with funders and different organizations and industry to actually say to them that in order, if you want to boost your participation in the clinical trials, we need to have a say in how things are done. And that's really because, this is about us. This is about our experience. This is about our disease. And we certainly are the experts in this area, and that we can contribute a lot of valuable input into this research process. So that's hopefully what we'll achieve with our committee.
Well, great, thank you. Anybody have any questions about the research committee?
There's also another sub-project whereby the research team has been working with Laurie Mishley to identify anecdotal clues that could lead to research questions, which I think is a really worthwhile activity. And just to sort of say on the back of that, certainly with us all here at Cure Parkinson's Trust, we're working very closely with a number of the PD Avengers in the research group on various different projects that we've got going on, including our annual conference Rallying to the Challenge, and also around some of the patient involvement work that we do a fair amount of. And it's wonderful to know that there's a committed group of people through the Avengers who are able to help people in different territories and not just here in the UK.
That's great. Thanks, Helen. Any questions about the research committee? Okay. I don't think Mark Van Grieken is here. Mark is our head of the Scotland hub. So one of the things that we want to do as we grow is we can't be at all places at all time, and we can't tell you what's best for your community in regards to what your needs are for Parkinson's. So we're doing a trial with Mark as the Scotland hub, where he then takes our global message and activates it locally. And he's building a Scotland, coalition of PD Avengers, and they will help determine what's best for their community. The idea here is that we all take ownership of our own communities. It's not us dictating to you; it's you understanding what's possible, and getting the motivation and the energy and the urgency from us to go out into your communities and actually make a difference. And then at times we'll come together for really big global initiatives like Race the Moon, which is coming up. And so we'll tell you about that in a bit. But if you are in a country, or I would say in the United States, a state, and you would like to be one of the next hub leaders, please reach out to me or Sonia and Tim, and there'll be a sort of a little application interview process for that. But we are looking for those people to be leaders. And the pay is great. No, it's not. It's nothing. It's actually, hopefully, the pay ends up being a cure for Parkinson's. That's priceless, right? And then we are looking to put together a paraquat committee for the people that are interested in tackling that issue. So if you're interested in that, please email me, larry@pdavengers.com. We are working with the Michael J. Fox Foundation, and it looks like, because paraquat was just approved by the Trump administration and the EPA for another 32 years. So what we need to do now is tackle it state by state and get it banned by each state. So we're going to start in California, hopefully later this year. So if you're in California, and you can rally the troops, you know who I'm looking at here. We could use your help. So if there's somebody that wants to sort of be one of the leaders of that, or just want to be on that committee, please email me and we'll put you on the list. Got a couple of people signed up already, but that's going to become a priority as we move along in the year. Any questions on those items? I see that Totan Adriana is now at her camera. Hello, Totan.
Hello, everybody.
So, how is Romania?
It's okay. It's okay.
So Totan has been a real champion of the PD Avengers in Romania, and we thank you for being on the call. Thank you.
Thank you. Me too.
How cool is that, folks? We've got Germany and Romania and the UK, and it's the US. We've got who else? We got Canada, obviously. Me. Any other countries?
Mm-hmm.
All right. Well, that's pretty good. So thank you all for being here. Next on our agenda, hang on, let me go to my agenda. We're going to, oh, sorry. Let's go to organizers and announcements, organization announcements and events that are coming up. I'd like to first bring Gabriella from the Davis Finney Foundation to the floor to talk about the Victory Summit.
Hello.
Hi.
Thank you for letting me steal a moment of your time. Hi, everybody. I am in Colorado in the United States, so I held off saying hello while everyone was doing the welcome because I knew I was going to have a moment later on, so hi. I do our community engagement work at the Davis Finney Foundation, and I just wanted to share a quick update. Many of you know the Victory Summit event, which is our flagship event and single day educational event full of inspiration and information on how to live well with Parkinson's. Previously, for the last about 10 years, it had been in person, although 2020 kind of turned that plan upside down on its head. And through 2021, our Victory Summit event is actually going to be online still. And it's going to be a little bit different from what everybody has traditionally seen it as. So rather than being location specific as the event had been in the past, with an in-person event, of course, it is a little location focused because geography. And But now with the topic specific, we have a newly diagnosed online event happening on February 20th, and registration is open for that event. If anybody would like to attend, it is completely free to attend, and the sessions will be recorded. So if it's not so friendly for your time zone to be online when the United States is in the middle of the day, that is okay. We will have recordings. You can still register and tune into one of the recordings. If you register, I think it's in the next few weeks, we are going to be sending program bags as well, so you can get some cool materials and a program book as well. Upcoming events as well that we have for the Victory Summit in April, we have How to Live Well with Parkinson's. June is Young Onset. September is focused on mental health and wellness, and then November is care partners. So those are our topics for this year. And I'll go ahead and just share a link in the chat for anybody that wants to find more information on the Victory Summit events or register for the upcoming newly diagnosed event. That's all I have for upcoming. So thank you, Larry, for letting me take a moment.
Sure, absolutely. Now, Jane, would you like to talk about the GDNF Unifying Challenge?
Sure. So just to give you a quick introduction, my name is Jane Calder. I'm a person living with Parkinson's. So my husband, Darren, has Parkinson's and has had Parkinson's for 18 years. He was given it as a little birthday present around the age of 40, and life's never been the same since, but it just makes us stronger, I think. So Darren was one of the people that took part in the GDNF phase 2 clinical trial, and it got us really interested in neurotrophic factors. And one of the things that this challenge is doing is raising the profile of neurotrophic factors as having potential. And I say potential, but there's lots of different areas that neurotrophic factors can impact from Parkinson's. And we've just, when we talk about urgency, we've just got to get the message out there. We need to get the funding, and we need to push forward with further research in this area. Having had a taste of GDNF, seeing the impact of GDNF on my husband, I just think it's really important that we further investigate these areas and drill down and understand, finally, what we've got, what we have the potential of. So the Unifying Challenge is about the GDNF participant group, who I coordinate, all pulling together with the 3 key charities who supported the GDNF trial. So that's Pure Parkinson's Trust, Parkinson's UK, and Funding Neuro. We are uniting to get the message across, and so that together we're stronger. And the point is this. So we're trying to get 42 teams. So that represents the amount of people that took place in that phase 2 trial, to cover 4,200 miles between the 1st and 10th of April this year. And so that'll culminate in a bit of a celebration, a bit of a knees up on World Parkinson's Day on the 11th. So 42 teams, we're well on the way to recruiting the amount. We've got about 36 of those teams already. You can have up to 12 people in those teams, and we ask that each of the teams covers 100 miles in between the 1st and the 10th. So good example, Darren and his team are riding Bristol to London on their cycles. They're taking 3 days. And covering 150 miles actually. I'm, for my sins, walking 100 miles over 10 days, so 10 miles a day over the 10 days on the Cornish coastline. So we want to turn this event into being a global event if there's anyone interested. So if you fancy setting up a team and working alongside us, you can go to gdnf.org.uk and find out all about this challenge. obviously we want donations pouring in because we want the focus on getting as much funding as we possibly can into research into neurotrophic factors. We've set up a petition. The aim is to lobby government to live up to their commitment of more funding to meaningful research into neurological diseases. So we aim to be dropping onto number 10, knocking on the door and saying, this is us. You've done with COVID, now let's move on, and we need to be first in the line. Urgency is absolutely required. And then, so there's 4 things that you can do. You can join us, you can donate, you can sign the petition. The 4th thing, very importantly, you can join PD Avengers. Together, we're stronger, we need to make our voices heard. So that's me, that's what we're about.
That's great, thank you, Jane. We did have a question. Can you define GDNF and what are neurotropic factors?
Oh gosh, Helen, do you want to answer that one?
Thanks for that, Jane.
Well, hot potato.
Okay, I can do normal speak. Perhaps I should do normal speak so that anybody that's not got a technical brain can get mine practical vision on this. So neurotrophic factors are proteins which can have the potential to regrow brain cells that are dying off or becoming dormant. So to feed a neurotrophic factor to a certain part of the brain cells can sprout life. That's what the potential is. That's what the theory is. So the science didn't prove it with the GDNF trial, and the CDNF trial didn't quite look at the same criteria, but there are enough clues there to warrant further investigation. And certainly if you listen to the patient's vision and versions of what they felt happened with the GDNF, they certainly felt a lot better, as was evidenced in the documentary that was aired at the time. So what we have to do is we have to marry up the scientific evidence with the patient's stories and come to the same result. At the moment, we're running on parallel lines and we're not quite there. And we have to get further investigation to, because I really do believe that we've got the potential of a disease-modifying treatment in our fingertips. We just haven't yet proved it.
Well, and we've talked about how it's important for us to be in research from from the very beginning at every stage. And
Yep.
Jane, you're working with the surgeon, correct?
Yes, absolutely. So, so we're working with the charities and with the surgeon. The GDNF participant group has become a real force for change, really. So what we want to know is that they are doing everything that they possibly can to incorporate the patient's feedback into any further research that goes on. So it's about us being at the heart of the change.
Right. And Helen, can you sort of put a fine-toothed pinpoint on the GDNF definition, the CDNF, and give us an update on that whole area of research?
That was inevitable. As soon as I unmute myself, there's a small yip from the floor. Growth factors, they're naturally occurring in the body, and actually there are a whole family of them. So BDNF is released when you exercise, for example. GDNF, the GDNF that Jane is talking about has actually been synthesized, and they have been infusing that into the brain in the Bristol trial. And I think all of us are very keen to understand is there a different way of getting it to where it needs to go in the brain to do repair? That doesn't necessarily involve the amount of burden that the participants endured, and magnificently so in the last trial. Because to go to the clinic every month to have a top up of GDNF in through the infusion system. It's pretty burdensome, and people were traveling great big distances. So we're exploring all sorts of different routes into that, and certainly the team in Finland who are looking at cDNF, they are looking at nasal delivery, which is encouraging. And there's also a team in the US who are now starting to look at gene therapy as an alternative, which means that, yes, it would be a surgical approach, but it would be one treatment rather than multiple ongoing treatments. So I think it's really important to keep all the avenues open. And we're also starting to look at really mini versions of growth factors, which will cross the blood-brain barrier and get to where they need to go in slightly different ways. So that is also coming, but that's a bit preclinical at this stage.
They did they're working on that in Canada, right?
So no, they're doing it in Finland actually. There's a lot of work going on in growth factors in Finland, but there's also other work that's kicking off around. So it's an important and interesting area of research. But as Jane says, we've got to move forward in the right way. It's absolutely critical that we listen to people living with Parkinson's and make sure that we get great science, but also great patient involvement. And I think that absolutely reflects the Avengers remit.
Yes.
Can I ask a question?
Sure.
It seems to me, am I right in thinking that one of the problems with the phase 2 trial was that there was an assumption that all the participants would be affected better by it, and we all react differently to, we all have different sort of features of our Parkinson's. Not everybody would benefit from deep brain surgery, but some of us would. So we need to assess the medications and the new treatments more subtly and more sophisticatedly, as it were.
Well, Paul, I think that's such an interesting point because, and Sonia, I'm sure you've got a lot to say on this too. Parkinson's is different for absolutely everybody. And so it's very hard when you're trying to prove a treatment. It's slightly easier when you've got an oral pill to take and you know that it's working on a specific target. But when you're dealing with something where you're trying to prove that it's changing the disease, you may see very subtle changes. Somebody may regain their sense of smell, or they may find that they can put their socks on in the morning. And those are the things that are really important. And we do need to learn to measure those effectively so that we can understand each person and how each person has improved and changed.
Because it seemed to me undeniable that some of the people on that trial benefited enormously from it. Isn't that true, Jane, do you think?
So from a patient's perspective, and I will keep ramming this home, this point that actually science didn't prove that GDNF worked. So, does that mean that GDNF doesn't work? No, it doesn't. Not in my book, because I watched the man that is my husband change radically, and his symptoms improve radically. So, the measurement tools that we use are so dated. I think we have to find a different way to ensure that the way that we measure it shows the difference it makes to the person. So while Helen talks about being able to put your socks on, being subtle, for a person with Parkinson's, actually being able to put your socks on is a huge thing. Being able to turn over in bed. There are lots and lots of things that don't get measured in trials that need to be measured. And one of the fantastic things that Parkinson's trusted as a result of the GDNF trial was look at different ways that we should be measuring Parkinson's in the future in trials, in clinical trials, because we can't keep using a system that isn't fit for purpose in my book.
Help me put my socks on, please.
Yes, I'll be right over. Thank you.
Thank you very much indeed.
All right. I also want to mention Race the Moon. Race the Moon, not Race to the Moon, because we're not going there. We're just racing the moon. So on World Parkinson's Awareness Night, there's a new moon, and the moon takes 28 days to cycle around the Earth. It's 1.45 million miles from Earth. So collectively around the world, the Parkinson's community is going to encourage everybody to run and walk and swim and do what you do to collectively go 1.45 million miles before the moon finishes its 28-day cycle. We can do that collectively around the world. And so what I encourage you to do is on the 25th of this month, the site will go live. You can go there now. It's just not ready to use 100%. It's racethemoon.com. The registration officially opens up on the 25th. If you've got a motor assisted bike, you can use that, but it won't necessarily talk to their program, because if it was a real race, you wouldn't be allowed to use a motor assisted bike. And we're using like a bicycle race company. And so we can count those miles. Even if they say, oh, you can't use that, you can use that. Trust me, I've been through this already, where people have tried to sign up and then they get frustrated because they need the motor assist, like me. So if you have any issues with it, you can reach out to me. But we're really excited about that. That's something that when we talk about a global vision and that is locally activated, this is that thing, because it is globally, we're working together to raise awareness and money for Parkinson's. But locally, you're doing it with your friends, family, whatever, and your local chapter of whatever. You can raise money for any of the Parkinson's nonprofits that you want to, as long as they're signed up in the hub. And so we're going to send out information to all of our partners on how they can sign themselves up, so they're one of the drop-down menus. People can pick them and they can raise money for them. And if you have another one, if there's somebody that you think should be in it, let me know and I can walk them through how to do that. But that's really exciting that this is an event that can raise money for any of the Parkinson's organizations worldwide that is a nonprofit. I mean, that's kind of amazing. I don't think that's ever been done before. And so we're happy to be a driver of that. Is there any questions about that? All right, I encourage you to go to worldpdcoalition.com to learn more about some really cool things that the WPC is up to. They're doing dual language webinars where there's a webinar in English, and then the presenters from that webinar in English turn around 30 minutes later and do it again in Spanish. It's very cool. And so that's happening. Also, they are launching for the first time the WPC virtual, the World Parkinson Congress virtual, which will be over 4 days in May. And it will be 80 different speakers in 5 different tracks. And 24 hours after that speaker is scheduled to speak, it'll be on tape. And then 24 hours later, there'll be a live Q&A. That you can turn into and put questions into. And everything's going to be recorded and available for 3 months afterwards. And so and each day, that day's program is released all at once. So no matter what time zone you're in, you can binge any of the presentations that you want because they're being recorded in advance. And then it's $25. And if that's prohibitive for you and you live in a country that is middle to low income, they will make some exceptions on that. But $25 seems like a pretty good price for 80 different speakers about Parkinson's around the world. And it's a very exciting time. And then also in the UK, there was supposed to be an art festival or an art gallery exhibit this in February with about, I think, 30 or 40 different artists around the world that have Parkinson's. It's super cool, by the way. Johnny Aitchison is one of them. And I know there's a couple, Tim, that are in your U-Turn group. That's been delayed till the summer because of the lockdown. But what they are doing is they're doing a contest right now. So if you go to Parkinson Art UK, then just Google that. There's a contest going on for drawing your 2020. And can't wait to see what that is. And I'm one of the judges, so don't bribe me. I don't like to be bribed. There you go. And does anybody else have an event or anything? Helen, do you want to plug anything that's coming up for Cure Parkinson?
Yeah, there are a couple of things that are coming up actually. We do a webinar series with the Journal of Parkinson's Disease, and the next one is going to be on young onset Parkinson's, and that's on the 31st of March. And then we have also got Rallying to the Challenge, which I know it sounds ages away, but actually it doesn't actually feel that far away when you've got to produce the content for it. But that's in October. It's the 6th and 7th of October this year. So, and this is an agenda that the content is very much led by people with Parkinson's, presented by people with Parkinson's, and it's a really stimulating research meeting.
Great, thank you. Anybody else?
Brian will tell you, he's been for many, many, many years.
Well, Brian is the keeper of the keys to that part of the region.
Exactly.
Is that going to be virtual or on site?
I don't know yet, Brian. I think we're just going to wait and see how many people have managed to be vaccinated, and it may be a bit of a blended thing. So the Grand Rapids team, it'd be amazing to see you. And if we can, and if we're able to fly over, then we'll come.
Great.
Larry, when was that Race to the Moon event going to be?
Okay, so that's going to start, registration will start January 25th, but the actual miles collected will begin April 11th and go for 28 days.
Awesome, thank you.
Yeah. And then I got a note from the Brian Grant Foundation. They've named February Kids of Parkinson's Month, and they've got a nice roundtable with some of the kids that have Parkinson's. Sonia, I know your daughters have done that with some roundtables too. It's always interesting to hear the perspective of children. I have an 11-year-old, so he's always a joy when things are heating up, and he's trying to take care of me, and then the next minute he's trying to stop my tremor by holding it. That doesn't really work, but it's interesting to see. And then sometimes he pretends he has a tremor. He goes, I think I got Parkinson's, Dad. I'm like, no, you're still going to take out the trash. All right. Anybody at this point? I think we're to the 12:30 mark in my time. But if anybody has any questions or comments, we're happy to stand by and answer some. And I will just thank everybody for being here and for all the work that you're doing to raise awareness of PD Avengers, and the recruiting efforts you're doing is just fantastic. And I'm really proud that we're at over 2,000 PD Avengers. We're at 50 different countries and territories. And the list of organizations continues to grow that we're a part of. So it's just really exciting time. Anybody else?
I want to jump in briefly.
Yeah, okay, Brian, you got the floor.
Dialing the numbers back that you were talking about earlier. In 2040, we're expecting it to double. We'll have 20 million people with Parkinson's around the globe. It's fair to say that in 2060, or there before, it'll double again to be 40 million people. If we use our math of 5 people are touched closely by the patient, that'd be 200 million people impacted by Parkinson's by 2060. So what's that mean? You look at those people that'll be in the sweet spot at that point in time. Well, Parkinson's can happen at any age. We see the numbers really start upticking at 40 years of age and beyond. So if you have a 10-year-old or 11-year-old, they're going to be in the sweet spot in 2050. The 10-year-old will be 40 years old at that point in 2050. That's when it starts kicking in. So the people that are between 10 and 30 or 35 or so are the people really we want to focus on. Because those people are the ones that it's going to kick when they get to their age, when they're most susceptible to coming down with Parkinson's. That's some serious numbers.
Yeah.
You know, if you want to recruit some people, talk to parents of young children. I see you have a 15-year-old. Here's what it means for them with Parkinson's. Well, we hope they don't get it. The numbers are going to be really stacked against them when they get to the age of more than susceptible to getting it. and they had some crazy stuff.
Yeah. It's when you think about it, it's shocking because, yeah, I mean, these people are alive today. They just don't have the onset of the symptoms.
Well, it's like a 30-year-old today, in 26 to be 70.
Yeah.
The numbers then again are going to be 40 million people, 200 million infected, and they're just going to be hitting the high end of the scale of age.
Yeah.
So,
yeah,
Rick, you were talking about being loud. I can be loud. We need to get moving.
And we can sign up those kids to be PD Avengers too. We got a couple of kids that are signed up already. You know, they can help us spread the word.
Absolutely. It's almost like we need to tap the pediatricians too.
Yeah. Get them exercising and stave off the symptoms for as long as they can. Does anybody else have any questions or comments before we say so long?
Hi, it's Nick here.
Hey, Nick.
If I can just add to that, I was talking to a university researcher last year who was saying that the general thoughts that they have is that with increasing in longevity, in the fullness of time, pretty well everybody who lives to a certain age will end up getting Parkinson's. So the total accumulative numbers are just going to be crushing.
Yes. And just like, you know, I don't think governments will be able to afford to upkeep us.
They don't get it. That's the problem.
Yeah.
There's no real buy-in to, you know, sort of forward thinking and treatment.
Well, there is with this group. This is where it starts.
You'd think our Prime Minister would get it. His mother has Parkinson's.
Yeah, she would, wouldn't you? But he doesn't.
No.
Bloody buffoon.
Somebody told me that a Conservative MP told them that what you have to understand with Boris is that he's only interested in two things: being king of the world and shagging.
Well, I can't fault him on that.
All right. Well, with that, just sentimental note, I will officially conclude this meeting, but I will stick around in case anybody has any questions or comments.
Thank you, Larry.
Thank you.
Thank you. Thanks, everybody.
Thank you, Larry.
Thank you. Thank you, Larry, and everybody else. It was a pleasure and
Thanks,
a very
everyone.
good laugh indeed.
Lovely to meet you.
Thank you for being here. Thank you so much.
Bye-bye.
Bye. Thank you.
Bye
now.
Hey, Larry.
Yeah.
It's Rob Warner from California. How are you?
Hey, Rob. Yeah, you're on the Paraquat list, right?
I hope so.
Yep, you are.
Awesome. And did you see my letter that
I did. I have not forwarded it yet, but I'm going to send it off to them and get their feedback on it. It's on my list to do.
Awesome. Cool.
Thank you for that. That's great. Great start, and I appreciate you pushing me on that. Thank you.
No problem.
Keep at me if you don't hear from me.
I will.
All right.
Definitely. Thanks for putting this on. This is awesome.
Great. Thanks, Rob.
Thank you.
Thank you.
Yeah.
Anybody else have any questions or comments? Carl, you're looking good. I like that dance move.
Yeah. I'm trying to get my partner in crime to meet you, Larry.
Oh yeah, bring him on.
Come on, now I told them that you're here. There are only like five or six people.
Come on, it's virtual. We're not even real.
It's virtual. Yeah, he's the one who did the.
He's the musician, right?
And he's a musician. Yes, he did the music for one of the videos for Parkinson's Art. But now he's so shy on me. I can't believe this.
Oh.
Yeah, come on, just. Now he's going to be mad at me. I don't want to get problems.
That's great. Linda, did you have a question?
He's been listening in some of what we were saying today. So.
Hi, Linda.
Hi, Larry.
How are you?
I'm good. I'm sorry I missed some of the meeting because I went on around 11 and then it said you were in another meeting and then I.
Yeah, we were having some technical issues and it was all my fault.
Oh, so I went away and I did something else. Then I thought, well, I'll just try once more. But
Well,
then,
we recorded it, so we'll put it on the website.
okay, it was very interesting that you pulled together all these people from around the world. It was terrific.
Yeah, terrific. Like I'm looking at you, and on my screen, you're right next to Totan, who is from Romania. So say hello.
Hello, hello.
Hello.
Hello, everybody.
Yes.
Hello.
Her, unfortunately, I don't speak Romania, and she is a very limited English, so she participates as she can, but she is a great recruiter of PD Avengers. So thank you.
Great.
Oh, sorry.
Okay, are you going to have these things? How often will these meetings?
We try to do them quarterly or more, but it just depends on the need. I think it's as often as we need them, but at least quarterly.
Okay, good. Well, so you'll put in the newsletter, the Avengers newsletter.
Yeah.
Great. Okay, great.
Thank you.
Thank you all so much.
Thank
We
you.
appreciate it.
Hey, Rob, and Carl, rather. And what's your name?
Angela. I'm Angela. Hi.
Hi,
nice to
Angela.
meet
How you doing? Where are you guys from?
Fairfax, Virginia.
Oh,
Too
how's
close to Washington.
Yeah, you a little nervous this week?
I'll get back to you.
Run.
No, thanks for doing this. We appreciate it. We were a little late. We were doing our rock steady workout on Zoom. So
good.
Had
That's
to
a
hop
good
in.
excuse.
Exactly. Well, thanks again. We'll see you next time.
All right. Take
Be
care.
well.
Thank you.
Bye.
Take care. Bye.
Hi.
Hi.
I'll head out now.
Okay,
It's so
Sonia.
nice to meet you, Totan. Really nice to meet you from Romania.
Hello, me too. Hello.
Thank you. Thank you. Bye now. See you, Larry.
See ya.
Bye. See you later.
How are
See you
you?
later. Eh?
You good?
Me? Yes, it's good.
Good.
It's okay. It's
Well,
very, very good.
oh,
Bye.
good. Lots of people.
Bye. Yes. Bye.
Bye-bye.
Bye-bye, Larry. Thank you.
Take care.
Thank you.
Thank you.
See, me too.